Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on Fox News Talk 1020 AM, 95.5 FM. You can also find us online at foxnewskoan.com. That's foxnewskoan.com. You got questions about your health today, this is the hour to call. The number here is 522-1020, 522-1020. Of course, always some reminders. During the week, you will find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's DR for doctor for short, ELLENBURG, drellenburg.com. List of our services, archive radio shows, websites you might want to visit, learn more about the world around you, how it affects your health, and some different books you might want to also check out as well. Again, it's drellenburg.com. I do see patients in Kenai and Palmer monthly. Please call our office at 563-2366 for times and dates of when I'll be in those places. All right, well, spring hasn't sprung yet, has it? A bunch of snow out there. Well, it's still March, right? Those long time Alaskans is the word I was trying to find, that long term. You know, so we kind of see what the weather sometimes. But get out and enjoy it. It is sunny out today. That's a lovely thing. So please get there and enjoy it. Just drive safely because it's still winter. All right, so what's on the docket today? Well, we got a list of things always to go through. We're going to talk about coronary calcium scans you can do on your heart. We've talked about them before here, and there's a new study that came out talking about their effectiveness in looking at people who might have strokes down the road. It's interesting. Talk about allergies. We're going to talk about chronic sinusitis, and a very interesting article I read recently over the weekend. We're going to talk about how to use your breath, paced breathing, to treat hot flashes. Quite interesting. And we will also get into today, of course, talking about cancer, and this, unfortunately, cancer risk being found higher among those who eat processed meat. So we'll see if we get past that. But let's just start with the first one. And again, this is a live call-in show. We do encourage your phone calls on medicine, of course. Our number here is 522-1020, 522-1020. So one of the hardest things about trying to help out a patient in general with cardiovascular disease, or if they have cardiovascular disease risk, or do I have any risks that I don't know about, is how do we look? How can we figure things out? And so obviously the cardiologist has a wide array of different tests that can be done. Look at your heart function, like an echocardiogram. So it gives you it gives basically the mechanics efficiency rating for your heart. You can also be doing things like a stress test. You can do an EKG. You could have even more serious things done, like an angiogram. They'll go up your femoral artery and go into your heart, femoral vein, and go into your heart and check out your heart directly. So that's a more invasive procedure. But this particular method uses a CAT scan, and it's called coronary calcium, CT, CAT scan. So computed tomography is what CT stands for. But they've been around, I think we've got to be at least 10 years now. They've been out. They are not horribly expensive. They typically, I think in the Anchorage area, the price has gone up a bit. And now different facilities are charging, I think, $150 to have the study done. And insurance does not pay for it, so remember that one. But what it does is it takes roughly 200 pictures, cross-section, or called sagittally from the radiologist's point of view, cross-sections of your heart, top to bottom, looking for hard calcified plaques in the arteries of your heart. Okay? So that's what it does. And it takes probably about 10 seconds to get the test done. There's no contrast fluid needed for this test. You're not given any IVs of any stuff. You are exposed to radiation. But luckily, due to the fact they use some pretty nice technology these days, it's a small amount. And I think the benefits outweigh the risk, in my opinion, on this one. I am one who is against over the use, of course, of ionizing radiation therapies that are in medicine at times, for sure. But there's one I think actually is a good one. And I've used it in many patients over the last several years. And with good good information, it can spur somebody on to make a change in their health, or to let them know that, hey, listen, as far as we're aware of inside the arteries of your heart, there are no hard calcified plaques. There might be some soft ones, but the hard ones that are the worst ones to get rid of, or you can't get rid of them, basically. Well, that's what people think. That's a matter of debate right there. Are the ones you could find with a particular test. So coronary calcium score. And this article appeared in the Journal of Stroke recently, looking at particularly stroke risk in men and women under the age of 65, and what they found out as the overall category is that it was predictive of stroke in both men and women, and was more predictive in persons who were younger than 65 versus who were older. And that's usually a big group are going to be screened long before they ever have any serious cardiovascular disease. Hopefully they'll find it a lot sooner than that. And what they do talk about in this article, what I really like, is some comments from some of the authors. And one is, we know that the coronary calcium scores can be a good predictor for heart attacks, but we didn't know if it was a good predictor for strokes, and they found out that it was. And this is an important test because obviously it can let us know if people have risk factors like for a stroke or for a heart attack, also known as a myocardial infarction. But it's the first study of its kind looking directly at this, which is great. And what they looked at again, so there's some highlights from the study. Over 4,000 people were screened, age 45 to 75, and the people who were in the study did not have any previous stroke, coronary heart disease, or any heart attacks, and were evaluated for stroke events over the next 7 years, 94 months. And what they had over that follow-up period of time is they had 90 folks who had strokes. Different types of strokes can occur. So there's one's called ischemia. That's like basically the pipes getting shut right off, and that can cause a stroke in the brain. And then hemorrhagic is where you actually have a break within the vessel in the brain itself directly, and it bleeds out. And that leads to, and it's not the same thing as talking about aneurysm. It's different, okay? But more commonly, strokes are the ischemic type, where basically it's clogged up, blood flow can't get through, boom, we have a stroke, unfortunately. Now, in this article, I did like the fact they actually brought up talking about what were some of the scores they actually saw and what were some median scores overall. And so they said people who sustained a higher risk long-term of having a stroke were somewhere around 104.8. That was the median. That was kind of, if you take a bunch of numbers, that was kind of the main one. So obviously there are ones higher than that. And in patients over the years that we've had these people do these tests, typically I'll tell them if you're over 100, you want to start making some serious changes. And if you're over 400, make some even more serious changes. And I had somebody recently, it was a female in her late 60s, and her calcium score was like 1,400. So definitely, somebody will make some interventions on to decrease that and get any worse, for that matter. And again, the study came out of Germany and did appear in the Journal of Stroke. So coronary arterial calcium scans, or they call them CACs or a CT calcium score. They have different names for them, but there are 2 places in town to do them. I don't work for either one of them, just so you know. But I will give them a little plug because they offer this test, and that is the Alaska Heart Institute and Providence Imaging. Both do this, and maybe somebody else does too. Just don't know about it, but those are the main 2 I know about. So check it out if you like. You do need to get a prescription to have the test done. You cannot do it on your own, so your doctor can provide that for you. If you have cardiovascular disease and it's, you had it for years and you haven't had one of these done, they're very, very cost effective and can provide some great information on if you should really step up even further your approach to treating your cardiovascular disease. Okay, what's on the show today? This is Dr. Michael Ellenburg. It's our medical show here on Fox News Talk. We're on 1020 AM. We're also on 95.5 FM simulcast. We're also online. You can live stream us online through the internet. And our URL is foxnewskoan.com. And, of course, if you want to call some questions, either about cardiovascular disease or anything in medicine, it's fair game, and we'll talk to you about it. Our number here is 522-1020. Well, something that came up. So I was down in Portland this weekend for a acupuncture conference. I'm also an acupuncturist and need to go out and get some CEUs, some continuing education requirements, as those are called. And there was an article someone brought up it was a patient they were demonstrating some procedures on, who they asked the question of, so were you born C-section? And it was just nice to actually hear somebody actually say that, because you don't hear that very often. You might be wondering, well, why is that important? Why if you were born C-section, would that make a difference? Well, one of the big things that makes a difference is, and on top of that, it also depends if you're also breastfeed, because the 2 big things that really help put nice, great, healthy bacteria into your gastrointestinal tract. So one, if you're not born C-section, you're exposed to mom's flora as you come out from her where, and that bacteria can help start seeding within the small intestine and large intestine. And breast milk is full of bacteria that the infant is consuming from mom, and can also seed this bacteria and build this nice, great environment for a very important part in our body. And even Kiko Matsumoto, who was our teacher, a great teacher, by the way, for acupuncture, commented many times about the immune system. 80% of the immune system is your GI tract. And I was like, that's exactly right. It's just so good to hear that, because it's true. And so there was an article, and it always segues and focuses on article, how it works on the show here, that was presented at the annual meeting for the American Academy of Allergy, Asthma, and Immunology. And that was in San Antonio. And the article was looking at what was the occurrence of developing allergies in children who were born by C-section. And they basically followed them for how long was this? Doesn't say. Oh, here we go. Researchers enrolled 1,258 newborns over 03 to 07, 2007, and evaluated them at 4 age intervals, which is great, at 1 month, 6 months, 1 year, and 2 years. And they even collected data from the baby's umbilical cord and stool, and blood samples from the baby's mother and father, samples from the breast milk, household dust. Well, they did a great job on this one. They really cover the whole area, in a sense, to get a better idea of how they're being exposed to things. And what they saw is that those children who were born by C-section were 5 times more likely to develop allergies than babies born naturally when they're, when they are exposed to levels of allergens in their homes. Dogs, cats, dust, mites. They weren't living in like sterile homes or anything either. They were actually in homes that are just regular homes, people doing regular things, and can be exposed to a variety of things that help seed that gastrointestinal tract. So it really goes back, to think about if you are have any grandchildren, you have children of your own, or even your anybody you're related to, your niece or nephew, and you're experiencing a lot of allergies, it really is important. It would be an important question to ask. If you know, hey, were they born C-section? Hey, did they breastfeed? This is really, really important. And if they're having a lot of allergies, they actually could be talking to the pediatrician or go see a naturopath doctor like myself, for example, and we could discuss ways of enhancing their child, or even as a teenager adult, or even as a major adult, your bacteria in your GI tract. That can still be treated. Even if you've been born by C-section years ago and you have allergies now, that can be treated. And not treated in a way where, okay, let's just treat symptoms. No. Let's treat the cause, right? That's what it's about. And, when I get asked about what I do in medicine, I'll tell people, even patients, or if I'm at a social event somewhere, I said, I'm looking at trying to treat causes rather than symptoms. Plain and simple. That's what I'm after. And, many doctors in medicine want to do the same thing for sure. This is one area where, unfortunately, we fall down that a lot and end up just kind of treating the symptoms because we're not really looking at the full picture of why this child or why this teenager or this adult is really having horrible allergies, maybe for a long time. So, great study. And again, that did not appear specifically in an article that appeared at the American Academy of Allergy, Asthma, and Immunology meeting that took place a couple of weeks ago in Texas. So let's follow along that thinking here. Let's continue more talking about allergies and those sort of things that make sense in a larger category, looking at chronic sinusitis. And again, some reminders, if you have questions about your health, questions about today's show, medical course questions, our number here is 522-1020, 522-1020. So chronic sinus problems, there was a very long providers in one of the many sites that I visit and trying to find information for the show that was talking about, how do you, and it had the medical term, chronic rhinosinusitis. We'll just call it chronic sinusitis. And so in your sinuses, you've got basically, you got like 6 pair of those guys. You got 2 kind of in the front part of your face, you got 2 over your eyes, and 2 in the back there that you can't really palpate directly. And those sinuses can become a hotbed for low-grade infections for a long time, and a lot of people. And in the patients that I see, and I see people, for a wide variety of chronic health disease problems, I would say that the most chronic problem that I tend to see in patients who are probably in the age, say 40 and above, is having some type of a chronic sinus issue. And if you're the kind of person who gets up in the morning and you got to clear your throat or blow your nose in the shower for a while to get stuff out, and that's something you always have to do because stuff is in there, you may have a chronic sinus problem. You don't have to get sinus headaches. You may have drainage down the back of your throat. One thing that I would recommend asking, because as a provider, I frequently look at physical exams on patients, and then when they come in with this sort of things, or reviewing their symptoms, and we hear, hey, I've got chronic drainage. Well, let's see in the back of your throat. Let's look inside your ears at your eardrum and see how it looks. And one thing we'll see frequently on the eardrum is a very small fluid line. Okay, and if you're really interested about this, get online and pull a picture of the tympanic membrane. That's your eardrum. It's a fancy name for that. And we were looking for a clear window of light with a little otoscope when we go inside your ear to look around. And it can be clear lots of times, but it can be this little fluid line at the bottom. A lot of patients, I'll come in and they'll say, well, my ears were checked, and they said they were normal, and so let's check them out. And I'm like, it's not normal to have that. And what is that? So the way you drain your inner ear is through eustachian tubes. And those kind of basically are if you were able to stick your finger down your throat about a couple of inches over to the left and right, you would feel the opening of eustachian tubes. They're very short, but they drain the inner ear. And if you have a chronic sinus problem, it's coming down from above. So imagine this is going on, it's like a little waterfall trickling down the back of your throat, slowly but surely. Goes by eustachian tubes. It can go up inside eustachian tubes and kind of harbor in there, be it bacteria, and probably have a serious ear infection. It could even be fungal. And I have talked on this show several times in the last couple of years, specifically about the pathogens in this case, besides bacteria, that can get involved with chronic sinus problems. And I hope that little primer there kind of gives you an idea of how it actually gets into your ears. And when it becomes a fungal issue or if it becomes a viral issue that's causing chronic sinus problems in patients, it's very, very hard to treat. It's just a fact. There aren't, I know some compounding pharmacies can probably make things for providers that can prescribe, antibiotics or antifungals or antivirals that could be inhaled into the sinuses. Antivirals not so much, but maybe I know they do make antifungal inhalants that have been used. And obviously you can also do the same thing with antibiotics. Because when you're taking those oral antibiotics, for example, for a sinus problem, remember that antibiotics are killing bacteria. They do not kill a fungal problem. So you could take those for many, many months, get a little bit better, but not get fully improved because you still have a fungal issue in your sinuses. That really is a whole problem, and that's causing this chronic, maybe occasional bacterial problem that comes up. You're probably wondering, well, how do you get it out? Well, that's the thing. So in this article, I was happy to see them talking about, it was a very mainstream article, talking about nasal saline irrigations. And that's basically taking saline in up your nose, or you spray it up in your nose. Those work pretty good. We've seen some better results with a product that's over the counter. And again, we give them away for free in our office because they're samples. And that's called Neilmed, Neilmed. And they were developed by Dr. I think his name is Dr. Manette. He was an ear, nose, and throat specialist, or an otolaryngologist is the technical term for him. And he realized that there are cilia-like, little hair-like projections within the sinuses that when you are using the saline sprays can make it kind of hard to get things out. And he somehow figured out that if you put in saline and the potassium along with the salt in the solutions, you get some better results. And I can tell you that in many patients, I'd say at least 60%, that's a good number I think, they have gotten great relief and sometimes cleared some long-term sinus problems just alone doing that. Now, one other thing you can do for that, which is a little bit hard to understand, but that's okay. That's what we're here for, trying to explain things, is doing a treatment called a sinus ozone inhalation. Now, you can't really breathe ozone because ozone, which is O3, three oxygens bound together, is highly reactive and is irritating to nasal passages and to your lungs, and it'll make you cough. And yes, I know folks saying, well, it's ozone layer. Isn't ozone bad for us? Well, ozone actually can be used in many things. This is one area where back about almost 8 years ago now, I met a dentist named Dr. Malika at a ozone conference. And he said, I'm going to tell you something that's going to help change your practice. And I was like, this is the kind of stuff you want to hear, right? And he said, you can take ozone and you can bubble the ozone and oxygen. Whenever you use ozone in medicine, it's always very low concentrations, like 1 or 2% ozone. The rest is oxygen. And you bubble that through olive oil. And what happens is that there's a change within the olive oil directly along with the ozone that now creates a kind of a strange name called a lipid peroxide. So you're not necessarily breathing ozone. There's a chemical reaction that takes place with the ozone in the olive oil that allows you to breathe the gas that comes off of that. And we have done hundreds and hundreds of these treatments in our practice. And we've seen some phenomenal results. We're treating chronic sinus problems. We've seen some phenomenal results in treating colds in children. A lot of kids don't want to get some type of IV given to them, sort of thing. So it's very easy to do. My son's done it plenty when he's been sick. I do it when I feel a cold coming on, because what that combination that comes out that you're breathing from the ozone and olive oil does is almost kind of like pop and put holes into the walls of the fungus that might be in there, or the walls and the virus that's in there, or the walls of the bacteria that might be in there. And about, I would say 50% of our chronic sinus patients specifically, we get great relief. And like I said at the beginning of this whole piece, it's one of the biggest problems I see in chronically in patients all the time, and they just get used to it. They're just used to blowing their nose every day. They're just used to the stuff in the back of the throat. You don't have to be used to those sort of things. Now, I'd be remiss if I didn't make a comment about other things that can cause chronic sinus problems that are not fungal, that are not bacterial, that are not viral. And certainly food allergies is a group we should at least mention a little bit about. And so, yeah, you can have certain food allergies that can cause chronic sinus drainage. I've seen it in patients, and I've been told from patients, I figured out I had something wrong with my sinuses. I changed the foods I ate, and it went away. I'm like, well, that's probably what it was then. Sometimes it's that simple. We're trying to figure things out. Empirically doing something, say, I'll take this away, see the change? Okay, right? And so don't ever rule out food allergies as a cause of chronic sinus problems. If you don't have any, if you never have, ever get infections, but just have chronic sinus drainage, consider going on a food allergy elimination diet, which I've talked about in the show ad nauseum about, where you basically eliminate foods from your diet for a period of couple of weeks, and you see if your symptoms improve. And if they do, then you now got to figure out what was the food. And that's the part of reintroducing those foods every 3 or 4 days to seeing how and what your body responds to. Because typically you're not going to have like an immediate IgE, is the term they use in allergy medicine, an immediate reaction to some kind of food and make your sinuses drain. Now, we can all talk about having the sinuses drain when we eat things like wasabi or eat some hot, spicy stuff at the Mexican restaurant, or some, I bought some Bajan sauce back from Barbados, and that'll make your sinuses drain. Or eat some hot Thai food. That's different. I'm talking about, somebody eat some food and like the next day, all of a sudden I got drainage again in my sinuses. I've been fine. So those kind of things to investigate within yourself at times. And you may not get the best results when you're trying to figure out food allergy testing. That's one of the best results is actually eliminating foods for a period of time, just a couple of weeks, and do a correct paced interval to figure out what your problems might be with foods. We've got about a minute or half a minute. Where are we at with our time here? Bottom of the hour. Yeah, we got about a minute, so okay. But that's a piece to really consider. Again, the product that I do like that you can get at most pharmacies is Neilmed, Neilmed. And the treatment we do at our office is called sinus ozone inhalation treatment. And it's inexpensive and can be quite effective. There are other, neti pots people have used for years. It's when you're heating up water and having saline in it, or different herbs can be used. There's a whole wide range of treating if someone has more of the fungal or bacterial or viral problem sinus-wise than, say, a food allergy that can be done. So important to consider that because, like I said, many, many folks are suffering from this such thing. So if you are one of those, consider the options that are out there that you have been looking into. All right? Well, again, it's Dr. Michael Ellenburg. It's our medical show here on Fox News Talk, 1020 AM, 95.5 FM. If you got questions about your health, I think we're about to go to the break here in about less than a minute. Our number again here, though, is 522-1020. You can call it the break, leave it, and then stay online or lay your question over, and we'll get back to it when it's over. So we'll see you back in a few minutes.
Gotta keep them separated.
Hi there, folks. This is Dr. Ellenburg. Welcome back to the second half of our medical show here on Fox News Talk, 1020 AM. Also on 95.5 FM. You'll find us online at foxnewskoan.com. If you got questions about your health, we do encourage phone calls. This is a live call-in show. This is not pre-recorded typically. But our number here is 522-1020, 522-1020. You missed some of our earlier things today. We were talking about coronary calcium scores, nice screening tests for coronary artery disease or for a screen that can be done. That's the places here in Anchorage. We also talked about allergies and its relations if you were born or not born C-section or breastfed, which can affect your long-term GI tract health for sure. And we also talked about sinusitis, chronic sinus problems in a large detail. And the second part of the show, let's get talking about a very interesting article. I find it, it's in a number of ways, and we'll go through this here, but right off the bat, it caught my title because it was entitled Paced, so P-A-C-E-D, Paced Breathing Compared with Usual Breathing for Hot Flashes. So usual breathing. And so respiratory rate for most people, is anywhere from, I think the average is like 10 to 16 of how many breaths you take a minute, because most of us are not breathing real deep in the first place. And in this study that appeared in the Journal of Menopause, there's a whole journal dedicated to this condition or situation. It can be a condition, but you can also go through menopause and not have problems too as well. So it's kind of a toss-up there in the categorization there. But what was done is that paced breathing. So what is paced breathing? It's a nice slow, deep down into your diaphragm breath. Okay. And by the way, most of us don't realize that if you take your fingers and you put them right above your clavicles or collarbone, that is the top of your lungs. That's where they're at. And you can breathe into your fingers as well and really use the full body of your lung. And why would somebody want to paced breathing? Why would someone want to deep breathe? Well, many times people will say, hey, take a deep breath, and it'll feel better, just in general. And what deep breathing can do, and if practiced over a longer period of time, is that it can really upregulate in a nice way the more relaxing side of your central nervous system. So your central nervous system, as we currently know at this point in time, is divided into two parts. One is called the autonomic nervous system, and then you have the central nervous system, and then you have autonomic, you have a parasympathetic, and you have sympathetic. And so the parasympathetic nervous system, for the most part, not for everything, is involved in relaxing things. And dilates your vessels open. Although parasympathetic system is also involved in how your pupils actually constrict. But the sympathetic nervous system, sympathetic nervous system is involved in, constricting your vessels in your body, getting that fast pace. The tiger's chasing you down the road, you got to run. Okay? That's the sympathetic part of the central nervous system. And when we do deep diaphragmatic breathing or paced breathing, as they put it in this study, it's reducing the activity in the sympathetic system within the body and encouraging more of a parasympathetic response. And this facilitates a relaxing response. And so the study was put together, very interesting study again, to assess the feasibility of and to obtain some type of benefit from doing different types of paced breathing programs for the frequency and severity of hot flashes. Now, the question you might be asking yourself in the first place is like, well, why in the world would this help in the first place? So how does a hot flash actually happen? And to be honest with you, they're not really fully understood. The fancy name for that is the pathophysiology of a hot flash is complex, as they point out here, and is not fully understood. What is believed is that the mechanism is related to a certain part in your brain in an area called the hypothalamus, in that there's some type of a in this case, a thermoregulatory dysfunction where you have trouble controlling your temperature. And it is mediated by the effect that you are making now less estrogen overall, and also resulting in what they call adrenergic tone, which is a longer term for suggesting that you actually have a change in this area, part of your brain called the hypothalamus. Now, we are suggesting that hot flashes are caused more from a sympathetic response than a parasympathetic nervous system. And so this is why they're suggesting that by doing the deep breathing and paced breathing, you'll be affecting that. And so based on this current understanding of how things we think happen with hot flashes, we want to decrease this sympathetic activity within the brain, and they believe that paced breathing or deep breathing can do that. And it's something that, certainly we can use for a wide variety of things, not just for someone trying to reduce the frequency and severity of menopausal hot flashes. And maybe even in those who are receiving chemotherapy. Frequently, many women who are receiving chemotherapy, and even in guys too, I've seen this, that they can develop hot flashes that are unrelated to the fact that they're receiving some type of hormone disruptor, or they can be receiving those, and that's why they're getting hot flashes. So it would be an activity used for them as well. And for years, I've taught many patients just deep breathing in general can stimulate to help you get relaxed. Like before you go to bed at night, if you have a hard time sleeping, besides turning to some type of a drug or some type of herbal product, or amino acids, which I love these things, amino acids that in herbs to help with sleep, is looking at taking something, in this case your own breath, as medicine in a sense, to relax your body before you go to bed. And it can work for a lot of folks. And you get good at it. You can do it while you're sitting in traffic. If you're sitting at a light, you can do it. Do it while you're driving. And, what I've been trying to do over the last month myself is that I'm a person who is a shallow breather. Part of my problem is I had asthma for many years and had shortness of breath many times, and I got so used to breathing short and not deep. That's just the way it goes. But if I actually focus on it, I can breathe very deeply without any problem. And but I still was training myself to do that. And what's very interesting about this study is that of the 100 people in the study, there was a very high percentage of people in the placebo group who were not asked to do anything else than just make sure they were breathing about 14 breaths a minute for 10 minutes at a time. Where with the people on the active arm of the study, they were doing 6 deep breaths a minute or 15 minutes, either once or twice a day. There were 2 different groups in that group. But they saw similar benefits for the groups even who were just doing regular breathing. Why is that? Well, the reality is you're focused on breathing itself, in itself was a treatment, not just in the fact that they're breathing deep, just breathing normally and focusing on breath. So they saw like a 42% reduction in hot flashes or effectiveness, in the group that was in the placebo group who wasn't doing the paced, P-A-C-E-D, paced breathing technique. So what a very interesting approach. Hard to believe it shows up on some very mainstream site at times because you think they want to be talking about what drug to be using or that sort of thing. Or we don't know how to treat it, so we're not going to treat it. So treating hot flashes, certainly in women who have menopausal age, can be very difficult. To put out there that I think is important is if you suffer from hot flashes long term or are suffering intensely from them, you need to contact your provider again and review what's been done in assessing your thyroid function, because thyroid hormone does affect the breakdown of estrogen in the body. So it's important to realize that. And the other part of that is that your adrenals, these little organs that sit on top of your kidneys, are kind of the last place where your body is, as you're going through the change and your ovaries are making less estrogens and making less progesterone, your body can now be looking to, in a sense, your adrenals for the backup. And your adrenals can make all your sex hormones. And so if someone has really good adrenal function, it seems to make their menopausal symptoms be way less and can even treat them that way directly, which I have done in some patients and had great results. Just alone treating the adrenals, much less all the different herbs that we were taught in our medical school program to treat menopausal problems. And those are good too. I'm not down on them. But it's just amazing what even just treating some good herbs for your adrenals can do. And again, we're assuming we're using these herbs for adrenal function. They don't do anything else. Well, guess what? We have a limited base for all of what we think about in medicine. Like describing the nervous system here a few minutes ago. That's what we know. That's not. Well, the question is, what don't we know, right? That's the question to be asking. And we don't ask the question very often in medicine, that's for sure. So please consider the use of deep breathing. You might want to treat your hot flashes, but this help you relax. One thing at times in patients, when someone's in pain, they'll hold their breath. When they take a breath most of the time, they actually feel better. It's that breathing effect. It has many things in the body we haven't even quite figured out yet. But one good technique for yourself to see how far you can actually breathe is to put your fingers there above your clavicles, your collarbones, and breathe in deep. And you should feel eventually something kind of just touch the bottom of your fingers. If you push down in the area, it's called the supraclavicular fossa is a medical term for the area I'm talking about. But your lungs go up that high, and you can actually feel your lungs right there. And when you do deep abdominal breathing with this, you're laying on your back and doing this, and you see your abdomen raise up, it's not because your breath is getting down into your lower abdomen. It's because it's pushing up your abdominal contents, because the lungs themselves on the back side of us versus the front side of us travel further and can push up our abdominal contents and make it appear as though we're breathing directly into our abdomen, our lower belly. So consider that. What a great article to bring up, and I'm really glad I found that today. All right, folks. Well, we've got about 14 minutes left today, so less than a quarter left. If you have questions about your health, questions about medicine, we do encourage your phone calls here. Our number is 522-1020, 522-1020. Questions about medicine? Go for it. That's what we're here for. So this next article, while we're waiting for a phone call here, it doesn't really surprise people, but it's worth bringing up, okay? And it appeared, I found it, if you ever want to read news outside the U.S., which you should as well, it's important to read things from different places. And The Guardian posted this one, and the results were published in the Journal of the British Medical Society of Medicine recently, but it appeared in the Guardian in the UK, United Kingdom, and looked at people who eat high levels of meat, such as bacon and other processed meat, had a 72% higher risk of death from heart disease and a 10% higher risk of death from cancer. And the meats included in this particular study were ham and bacon and sausages and burgers and such, and luncheon meats. And the study looked at data from over 400,000 people in 10 European countries, including the UK, and found that the biggest consumers of processed meat were about 40% more likely to die prematurely from any cause than those who ate very little of it. And I already mentioned the increased risk of death from heart disease and cancer. And basically, the study looked at if everyone ate no more than about 20 grams of processed meat a day of food. Well, that's actually quite a bit if you look at the reality of that. But it says here a small amount of red meat also seems to benefit health because it contains, of course, important nutrients and minerals. So it's all about moderation, correct? That's what it's always about with food. And one person argued in this article, because she works for the meat advisory panel, that, people who are eating a lot more meat, don't tend to really have the healthiest lifestyles in the first place, and we need to take into consideration what else they're doing and why they may be developing. Well, certainly that's the case, but we do know that most processed foods in general are not good things for us to be eating in the first place on a regular basis, nor they are intended for that. But a lot of us, due to time and because we don't want to change our diets, choose those things because you can. And certainly I'm not against someone occasionally having bacon or having a hot dog or something. If you're going to have a hot dog, you might as well go out and buy a buffalo one or go shoot your own animals here in the state of Alaska and have them made for you directly. And the meat that I do eat is free-range game that we ourselves as a family go out and get. That's what we eat. That's our meat source that we get 99% of the time. So it's important, and most Alaskans, a large body of Alaskans are doing that and aren't eating a lot of these processed meats. But it's important to realize, too, which you don't get to in this article, a lot of things put into processed meats that may be playing a factor, too, in increasing cardiovascular disease or increasing cancer risk or increasing all mortality causes, means likely like chance of death in general, that are inside these foods. That's a big piece. And this huge study came out of the European Prospective Investigation into Cancer. This is the group that it came out of. And they've been following this group now for several years, and it involves age 35 to 69, and is looking at all-cause mortality, including cancer. And as of June, from the latest data that was brought in June of 2009, there's been about 27,000 deaths. And so we're looking at that directly, and that's where they get some of these numbers, looking at these processed meats. So it's important to realize what you're putting into your system, right? And how to keep yourself in a healthy state. And, occasion of having a treat's one thing, but all the time, that's another, right? So remember that. Get your own meat, for that matter. And certainly I'm not people against being vegetarians. I think it's hard being vegetarian in Alaska. That's my opinion on that one. But those who are, more power to you. All right, folks. Again, this is Dr. Michael Ellenburg. Our phone number here is 522-1020, 522-1020. Questions about your health, questions about topics, questions about processed meat, give us a call here. We'll talk to you here if you like. Got a couple of top stuff on today's agenda, so let's get into those. One thing that's important, because it came up again, is we've been discussing over the last few weeks, and I came back from a cancer conference, is really looking at cancer and nutrition and trying to understand that. And again, something to consider if you do have cancer, or if you know somebody that has cancer, is really how important their dietary approach needs to be. Some important things are, one, low sugar to almost no sugar. Sugar feeds the body and creates glucose at higher levels and feeds tumors, okay? Lots of carbohydrates, like from starchy foods like potatoes and pastas and bread products, for example, are going to eventually be turned into sugar within your body and can also be used by tumors for an energy source. So low carbohydrates, almost no sugar, are extremely important. And an area that we'll see more and more going on, looking at, is the use of even having people restrict their calories when they have cancer, because it can turn on certain parts of our immune system. And that's something really to consider, because it can make a big difference. So I really encourage people out there, if you want to, to really look at some novel ways that are coming out, very mainstream in a sense because of the research, but that's okay, of how to really treat cancer on a larger perspective besides chemo and radiation, and using diet as a huge piece in it. Disrupt the way the tumors actually grow by eating different foods. Wow, what a great idea, right? All right, we got a caller on line one. Sergio, are you there?
Yes, hi. Thank you for taking my call.
Sure.
Hey, I was just wondering, could you please explain a little bit more, what does that mean, the genetically modified food? How much can affect our body, and why United States, they're not allowed to label those products when they're genetically modified in the grocery store?
Sure. All right, good question. We got some time for that one, too. So GM foods, basically, just understand, people don't understand genetically modified foods, or genetically modified organisms, or GMOs, you can call them as well, is where we're basically modifying at a level within, at the gene level within foods to make them do certain things. Like, for example, they use it with soy so that when Roundup gets sprayed on it, it's going to be able to degrade that pesticide and not affect the soy. You can go. That's okay.
I'm sorry. How much can affect our bodies? Because that's why it's autism and cancer and a whole bunch of different things.
Well, Sergio, we don't know is the answer. What we are starting to find out, though, are the animal studies that you never see printed in the news, hardly ever. You really have to go online, look around. So there's a couple of sites online that are worth checking out. One is called ISIS, ISIS.org. I checked them out. GMO Watchdog or Watch.org, it's something like that. It's a great site, but the ISIS is the Institute for Science and Society, and they have been the biggest posters in a sense of nice information, very detailed, by the way. It's science, they're not messing around, very science-based as to what we're seeing actually happen in a fair number of animals along the way. Now, with that said, I do know some anecdotes along the way that I've read concerning some of the human exposures. There's stories of people like having crops grown in certain areas in some foreign countries, for example, and being exposed to them the first time, and half the village developed allergies. Never had them before. Right. Stories of like sheep in India getting a hold of BT cotton, which is a type of GM cotton. They ate the leaves, and like about 150 animals died from lesions on the liver. So we're messing with things at a level that we don't even understand. We think we do, but we don't. And in the U.S., what we have going on is that you have basically companies claiming they're right under the Constitution. The 14th Amendment is what they use as their biggest argument, because that constitutional amendment freed the slaves. But what it also did is it put a kind of note in there saying, and any U.S. citizen to the pursuit of life, liberty, and happiness. And through the work with constitutional law over many years, they've construed that to literally include a corporation as an actual individual. And that's why Monsanto has had carte blanche to really do what they want to do for the most part. As time has gone on, and
because I got kids, so I think we have the right to know what we're going to feed our kids when we go to the grocery store.
Absolutely, you do. And luckily there are some manufacturers of food, like for example, some of the food you can get over at Natural Pantry here in Anchorage, that will say GM free, GMO free, and they're required by law in Europe to be doing this on in most countries, GMO free. Right. So we just haven't got around to it. And it's an example again of where corporate power trumps health issues and important things that should be changed when they're not.
Right. So we don't really know what happens to our bodies.
No, we don't quite understand that. What's the step to say, okay, if it goes in here, what's going to happen? That's the question I have. I have that question actually on wheat, and somebody recently told me that there's not much GM wheat here so much as the fact we use one type of wheat in the United States versus what's used in other countries. But I certainly believe that, why couldn't we have, some type of a change in the immune system, specifically when you expose your bacteria in your GI tract to bacteria that have been artificially put into these GM foods. What's that going to lead to? And I certainly would suggest that people eating, as time goes on, we're probably seeing more allergies for a number of reasons, and one of them could be GM foods if we consume a lot of those type of foods.
Right, I agree. Well, thank you so much for your time. I appreciate it.
Yeah, great question. And as we go along with on GM foods, there's been a lot of books written on this. A couple, 5 years ago, we had put on a couple of movies that showed up over at one was mostly how your food came from. The other was on GM use in foods, the Beartooth. So the information is out there, just not in the sense of how does it really directly affect the body, and that's the part where we're missing. And I think we'd have more people on board if we really could get some clear science to demonstrate how it happens and get those people who say, well, I don't believe that because you can't demonstrate me on paper or on science or biochemically why this person is sick from eating a GM food. And furthermore, I would tell you that most of that data would be kiboshed and like hidden away and put in a drawer somewhere. And certainly would have a hard time getting funding. That's because it's goes deep, and people are making a lot of money off of GM foods, and Monsanto is one of the biggest ones around doing that. So, all right, again, great question. And again, that site online, I'll repeat that again, is Institute for Science and Society, ISIS.org. They have a free email newsletter that comes out once a month. They have some great books on their site that you want to read any of those that you can pick up, but you got to pay for those. But they have a lot of free information, which is great. And if you get a chance to go to their site, I would encourage you to go read their mission statement. It's very short, but it will explain to you what their take is on presenting scientific information. And that's one of the best reasons why I like these guys the most. So, again, Institute for Science and Society, ISIS.org. Okay, well, we got about 2 minutes left, right? No, more than that. Good. All right. Maybe less. But quickly, again, some reminders. One, in getting back to the cancer diet, because I have an article I want to get to on diabetes that's going to last longer than a couple of minutes, so we'll save it for next week. But again, with the cancer diet, it's important to understand this information. And, a lot of times, and I see a fair amount of cancer patients in our clinic, and they'll come in and they'll it's not picking on the oncologist. I'm just saying what they're telling me, and they're saying, I don't have any idea what to eat. And what I'll be told a lot of times is, they'll say, well, you know what? I was told I can eat what I want to eat, and don't even worry about it. And no, that is not the way I would approach this. Let's put it that way. We need to, bring in any direction we can when somebody has cancer and look at all that perspective. The biggest thing, and I understand this, when someone comes in to see their oncologist, it's like, so much going on, having to get involved and really describe to the patient about what foods they really should be not eating requires a whole of the visit to come see them or come see a nutritionist they have trained to teach them how to do this. And by the way, a couple of clinics in Lower 48 are doing it just like this. They come see the provider, and they're sending in for another visit to see the nutritionist on how to actually eat. What do I eat? Okay? Because when I tell you out there, hey, don't eat any sugar, don't eat any low carbohydrates, I know it's difficult to say, well, what does that really mean? What's he talking about? Well, on the no sugar, that means no goodies is what that means. Maybe occasional treat. But you want to take away fuel sources for tumors. It's extremely important. And you have a way to do that through your food. But it requires some serious restrictions on your diet and what you're doing. And that is the hard part. All right, folks, there's a sign that our time has come to an end today. I do appreciate the phone call there, Sergio. And for those who are listening out there, thank you as well for listening. I'll be back here next Monday, 2 to 3 p.m. Everybody have a great week, and take care.
Hand of poker there. All new directions must go everywhere. Big round people in a cool little square. Or you can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby.